Thank you for tuning in to another episode of Help Nobody Told Me. I'm Jasmine Shapiro. I'm with Berkshire Hathaway Home Services here in the Chicagoland area. I'm hosting together with Jordan Kagan, and he is the Man of Silver. And we're so excited to have Mary Fedorowski with us today. You are the CEO of Avoa Health.
That's correct.
So Mary, tell us a little bit about your path to getting to being, a CEO at Avoa.
Oh my gosh. So I've been in healthcare, I am going to be 44 in June, so nearly 23 years. I started off in healthcare as an EMT, working on the ambulance, and afterwards moved more on the corporate side of healthcare, working for places like Blue Cross Blue Shield, Delta Plans Association, and Advocate and Ascension Healthcare Systems. But specifically with Avoa Health, what made me go into this field of work is really because my mom had a terrible experience in healthcare. And long story short, she ended up getting great care afterwards, but we were able to step in, and with the network that I had at that point, which was almost 4 or 5 years ago, now that I'm thinking about it, was much more robust now, obviously. But when that kind of all got settled and she was able to get great care and just know, like, okay, the pressure is off, at mom's okay, started to think about, what do people do when they don't have a Mary they can call? And the answer is people are really stuck. And that, of course, like a dog with a bone, I'm looking into what can we do about that, and looking into doing more competitive analysis for other folks who do care management and patient advocacy. I noticed there was a lot of big holes in terms of hospitality and how folks are supported and treated, and that would led us to start Avoa Health in January of 2025.
So it's so interesting because this podcast is about life transitions, right? And we've put together a team, so it's me and Shannon, our realtors, and Jordan's the Man of Silver, and we have a home organizer. And we wanted to get the message out because so many people don't plan for a crisis to happen.
Yes.
We go through our lives and we just don't ever think anything bad's going to happen. And then when it does, you're in a crisis, and now you're not making decisions clearly, right?
Absolutely not.
And it's so important to have someone like you to then be able to call and say, I have no idea even where to begin. And you're worried about your loved one. You have a job, you might have children. Like, how am I going to figure all this out?
Oh my gosh, all the time we get phones like that, calls like that, with folks like the sandwich generation, our age,
right?
30s, 40s, 50s,
Right.
60s, depending on
Please clarify, because I keep realizing not everybody knows every terminology.
Oh.
What is the sandwich generation?
Great question. Really the folks that are our age, so 30s to about 60s, depending on how old your parents are, that are both, you're kind of in the middle of the Oreo part, the cream part of the Oreo sandwich, where you're taking care of kids or folks who are younger, and then also taking care of your parents. But that could also be your parents taking care of their grandparent, your grandparent as well. So we have a number of families that their great-grandmother may be 95, their mom is in her early 70s, you're in your 40s and 50s, and you have kids too, and you're trying to deal with all this upward care pathway, which is very overwhelming and very stressful for families, of course.
And some generations have multiple, or families have multiple people to help out.
Of course.
And some are an only child.
Right.
So
that
as an
pressure
only
is on
child, you have a mom and potentially grandparent and a kid. So
Correct.
3 people are
Right.
feeling like they're desperate for your attention.
Correct. And you're only one person that could be stretched so thin, let alone having responsibilities of a job. Trying to take care of yourself at that same point is very stressful. And, seeing a friend and, having a little bit of fun in the meantime to de-stress is very challenging.
So why do you think most families only seek help after a major health event? I mean, do you think they're embarrassed, or they're not aware, or what would you think would be like the main reason?
From my experience with our people that we basically help and assist out of this, the children who typically call us that, hey, my mom needs help, or I'm noticing that they need some assistance, or I don't know what to do, I'm overwhelmed. They're typically very high achieving people that are experts and are ready to go. So you think, someone needs more assistance. I just need to work harder. I just need to figure this out myself because I'm responsible for this person. I'm responsible for the situation. Instead of asking for help in the beginning. So by the time they really realize that, I'm really overwhelmed, or I'm really burnt out on this, they could have called us 2 years ago and we would have helped to be in a much better position. Additionally, many people wait until there's a big event, like a trigger event, like there's a fall or health crises, and then they realize, oh my God, I am way over my head with this, and I need to have somebody to help now. And that's really not the time to call us, but obviously we're so happy to help at that point, to get some relief and a little more of a peace of mind.
And it could be, I pulled my back out for the first time and I can't move and I don't know. Or I stood up at 55 years old and something popped in my knee and I don't know if I should be going to my chiropractor or going to an orthopedic.
Correct. We don't provide medical advice, but yes, of course, we can certainly steer you right in the sense of, hey, let's get you assessed somewhere. We'll get you into, I know a great orthopedic, he's Dr. Kim at Northwestern or whoever that is.
And when you call your normal doctor and they said, well, we can see you in 6 months, you have a way of you have connections that might not say we have to wait 6 months.
That's correct. And I also like to say I'm benevolently annoying, where I will just make friends with like the front, hey Kim, how are you doing? How's your dog? By the way, is there any openings that happen to be left? Or if I'm in the neighborhood, I'll stop in and say like, so they know who I am. So when I call, I'm not a stranger. Those relationships are so incredibly important when it comes to just building the network that we have in terms of providers and other non-medical assistants, but also just have that person that I can call immediately that knows who I am or knows where my team is to get that wheel a little bit more greased.
Yeah. So what does it cost emotionally or financially when they wait too long? Loaded question here.
That pregnant sob, like, also I think knowing laughter, I think, in that sense too. Financially, really, it's the erosion of that person's estate. When you are looking at having, say, for example, a diagnosis of dementia, there may have been financial or other social issues that started well before that diagnosis. From years beforehand, there could have been some slippage of loss of finances. Also, when you're making decisions based on limited information, you may not make it maybe the best decision for yourself or for your family member without that little more information and assistance. In terms of emotional cost, it's really the relationship you have with your family. Mm-hmm. So if you are an unpaid caregiver, so that is, say, somebody who is a child or a spouse or helping your grandma or your mom or dad or your sister or brother or your husband or wife, that you now just not only become that role in your family, you are now a medical expert, you are a financial expert, you're an insurance expert, you're a project manager, you're a chef, you're God only knows what, on top of everything else, leaving that relationship to really suffer based upon all those other skills that you're taking on. Mm-hmm. So when we work with our clients, we take on the administrative and logistical burden off of their plates so they can really return back to just being a family member, knowing that everything is working in the background.
And I think we've talked before here with other people we've met.
Mm-hmm.
If you wait too long, for an example, and you don't have the proper power of attorney, medical power of attorney, will,
yes,
and now you need to have a guardian appointed because
mm-hmm.
someone's not of sound mind to do it now, that is really expensive.
And very, very challenging logistically. So, always, when's the best time to do something? 10 years ago? When's the next best time? Today.
Mm-hmm. So talk us through, do you have concierge service or an a la carte, or what happens when someone reaches out to you?
So first of all, we try to get as much information as we possibly can to know if we're the best fit for them. Otherwise, we have plenty of people we can refer to.
Okay.
And say, for example, they do want to work with us, we are the best fit for them. We make sure that we have as much information as possible. So even before, say, for example, you refer us to somebody. Hey, Mary, my best friend's mom is really suffering. She needs your help. Here's her number. I'm going to ask you a ton of questions. Roughly how old is this person? What do you know about what's going on? How can I support your friend more than that? All of those things that, if it's a medical provider, that'd be more medical questions in clinical sense, of course. Because the worst thing I hate to have people do is repeat themselves, especially when they're in crisis, mm-hmm. and say, by the way, I know you just told your doctor all about this. Can you tell me again all about this? No. So I try to get as much information as I possibly can. On top of that, I want to make sure that I'm being really straightforward with them and what we can and can't do. So we don't provide medical advice, for example. So if they're saying, should I do this? No, but I can't tell you what to do. But I can definitely provide you with some options. And the other aspect of things too is making sure that they really understand that we are both supporting their loved one and their entire family. So it's not just we're going to take care of your mom. I say this all the time to my clients. I'm here for you too. We are here for you as well, because we don't even just focus on the clinical aspect. We look at it from a more holistic sensibility.
And then does the family, do they utilize your services?
Oh my gosh, yes.
Yes.
I get phone calls all the time. I speak to family members more often than I speak to my actual client.
So can you share us like an example of a story? I mean, don't use people's names,
Of
but
course.
just like, give us an example.
Of a recent
that.
person that we helped or in general?
Or just someone like that you help the family members too.
Great example. So, might be one. Okay. So, over the summer, we had a client who was in Chicago and was actually had recently fallen in front of the Field Museum. He ended up breaking both his arms and his kneecap.
Oh my gosh.
Big injury. Big injury. He actually lived in Southern California, so he didn't have any family members here. And when they were here for a little bit, they actually had to go home because they have wives and kids and jobs to not get fired from, right? So we stepped in as that family member in the hospital setting to advocate for that person because he
Are
truly.
you allowed to?
We are, yes. At that point, we are. So we can certainly say, again, we can't sign anything. We're not POAs, but but obviously that person was cognizant and was able to make medical decisions for themselves. But in terms of what needed to be done, there was like a rock in the hard place because this person was at Stroger downtown, so way back in the same West Side almost. They were going to be transferred over to Rush next door, but Rush and Stroger were not talking because both social workers are incredibly overwhelmed, and they're like kept playing phone tag and like I have 40 people to deal with. I can't deal with this, right? And then on top of it, they had Kaiser Permanente insurance, which is not accepted in Illinois. So the both hospitals weren't talking to each other, and then the insurance company wasn't able to give a pre-authorization to move because both hospitals were not talking to each other.
Oh my gosh.
It was a mess. But instead of him waiting around for another weeks and weeks and weeks to get transferred for care, we ended up getting him transferred in 2 days over that. So we were stepping in and saying, hey, I'm going to make best friends with a social worker. What paperwork needs to be filled out? I can help fill you out for you because he couldn't utilize his arms. I have his insurance information. I have his, social. I have his stuff I can help with, making sure your life is as much easier as it can be. And then also I made best friends with the liaison at Rush to say like, hey, what do you need to get done? Let me try to help you get that done. And then ended up fighting with the insurance company to get it covered, which it eventually was. So he ended up getting great care.
You were his guardian angel.
My gosh, it was so great. And then, his family was so thankful because they were in Southern California and also New Mexico, and they were on the phone, on speakerphone with the team, which wasn't really helpful versus somebody there quite literally in someone's face being like, I need your help with this. Can you help me with this? And it's magical how things just kind of happen that way too.
It must be so rewarding for you too.
It really is. I mean, honestly, God, it's a privilege. It's stressful at times, but it's of course a privilege.
So how's he doing now?
He is great. He is great. Last I talked to him was about Christmas time. He was wonderful. He was in outpatient rehab. Everything was great, hanging out with his grandkids.
Oh,
Awesome.
That's such a great story.
Thanks. And it's such a blessing. It really is.
So you really do need an advocate.
Oh my gosh, yes.
Especially in this day and age. I mean, I think that healthcare workers are doing the best they can, but they are overworked.
Absolutely.
And like you said, these social workers, I mean, they had such a big caseload at both hospitals. So somebody like you, I'm sure they appreciated it too.
Oh, yes, of course.
Not just this individual that you are representing, but the healthcare workers as well.
Absolutely.
So, I mean, I think that's so important. And what's the difference between a hospital-based navigator and an independent patient advocate?
Well, the main difference really is independence and autonomy. So we don't work for a healthcare system. And I will start by saying with the caveat, people who do patient advocacy in the healthcare or navigation in the healthcare system are wonderful people, and they provide such great services and resources for clients there and patients there. Fantastic. Keep doing what you're doing. The thing with us, though, that's quite different is that we do not have any financial or business relationships with a certain system or providers. So we can say we think Dr. Smith is the best because we know his value and also we know his outcomes for his patients. So we can refer to somebody else in a different system, in a different area that works for that patient, that's the best person for them, versus having to be stuck in that one system. If you ask, your doctor from ABC system to say, hey, what's the best orthopedist? They're going to refer to somebody in that system when the actual best maybe knee surgeon is at Rush or at Shirley Ryan Rehab instead. They wouldn't necessarily refer that. But if you have somebody who is independent like us, we can follow you throughout the entire care journey as you go through different systems and your needs change as well.
So is that pretty unique?
Typically, yes. There are other independent patient advocates and care managers, of course, but it's great to be independent in the sense that I don't have any. I'm agnostic to what we serve. We only focus on the client's needs. That's it's the biggest priority.
And a hospital might be a not-for-profit, but they still, in the end, care about their bottom line.
Of course.
And their bottom line might not be what is always best for their client, especially if insurance is only going to cover 3 days and you should stay a 4th day.
Yeah.
They don't want you to stay that 4th day, but someone like you might know exactly how to word it where we don't want to further injure or health problem. Can we please find a way for them to stay one more night?
Of course. And say can you please let me know in detail why this decision was made? And having them explain it to us versus the other way around. Like instead of saying, I understand your decision is like you need to be discharged tomorrow. Great. What is the decisions that led to that? What led to that diagnosis? And him being discharged? Because from what I'm seeing, he's still on A, B, and C medications. He's not, improving in this way. So what was that decision based on? Can you provide me the evidence based on that? And it's like, oh, well,
we need the bed.
They obviously won't say that, but say that, oh, well, he's pretty stable. Okay, really, what? Because I see his blood pressure fluctuating here. Can you provide me that? You basically put it on the onus on the person in front of. And mind you, I don't want to push too hard on nurses because they're doing their best, or doctors are really doing their best. But on the hospital system administrator, I will push back on for sure. In the business office, I will push back on that. Like, tell me why that is. And if they have it on paper, it's very hard to say like, oh, well, maybe we can make an exception. Oh yeah, that'd be great. Thank you so much. I really do appreciate you reconsidering his discharge. Thanks.
So do you think it's because you were an EMT that you have some of this medical knowledge too?
Oh, for sure. And also just working in the insurance and healthcare systems itself, because it's great to have the basis of clinical knowledge, of course, but also be able to navigate insurance companies and the hospital system as a whole, and knowing very much in depth of how that works is really, really important. Also, the members of our team who also are health advisors are all nurses that we have on our team. So having more clinical experience in that sense. And we have great clinical partners that help us as well.
Someone being able to read an EOB.
Estimation of benefits, by the way, if you don't know what that means.
To make sure I am being charged by my insurance company and or the hospitals for what has been really done and things should cover that really took place. Does your service know, is part of what you perform, looking at those, making sure I'm being billed accordingly, correctly? Or is
yes. We'll do a cursory overview. I'm not a medical biller by trade, but if I can definitely look at something and that seems off, or that's really not right. Let me do some more investigation on that. The other thing is you could always, this is a good tip for all your viewers and listeners, is you could always negotiate with hospitals. Always do not feel bad about negotiating with hospitals, especially the billing department. Most people don't, and you'd be surprised. I recently had a lab bill for one blood test that I had. It was $150, and I'm like, well, why didn't my insurance cover that? They're like, well, it only covered 10% of that. I'm like, I'm not able to. I don't think that's the right amount of money. What is the best money? What's the best charge we can do? We can do better than that. So what can we do about this? Well, let me see what I can do. And I ended up paying $75 for it instead of $150.
Oh, wow.
So it's just about
dinner.
It's just about asking that too. If you see this huge bill for $60,000, first of all, get an itemized bill about why you're going through this. What exactly did you charge me for? And if you go through it and say like a Kleenex box, be like, I'm not paying for that. I'm not paying for this. I'm not paying for this. And then, or you can ask for the Medicare charges if you really wanted to. That's another tip you can have for that. It won't always do that for you, but it always helps to ask. Please, please, please advocate for yourself financially too.
Wow, that is a great tip.
There you go. You're welcome. Save you $5 a dinner.
Yeah. There you go. So you're saying the first 2 to 3 steps would be to reach out to you.
Absolutely. So if you
Figure out what is going on,
Mhm.
what type of help they need from you and
Correct.
your company, right?
correct.
And then do you put together like a plan for them, or, so they know what they're walking into, what the charges are,
Of
everything?
course. I mean, our charges are public on our website. So if you go
Okay.
to avoahealth.com, you'll see what we charge. That's not, we're a big fan of being transparent when it comes to that.
Okay.
It really just depends on what that person needs. So for example, if they just need a small amount of work, we'll just charge for a couple hours of that. You're not going to pay them our monthly retainer. That seems silly to do that. If that person is in a significant clinical crisis, then we're going to be stepping in. And when it comes to what steps are, first you can either call us directly or go to avoahealth.com and look at there's a link to like a little form to fill out for contact information. You can add information there too. It's HIPAA compliant, so you can put things on there. Additionally, along with that, you'll get a phone call back from us and saying, hey, I'm hearing A, B, and C, what's going on, or I heard from a friend of mine this, or a doctor friend of mine, this is what's happening. How are you doing? What's going on today? Has anything changed? And then say, typically with someone like you, I would expect we're doing A, B, and C, and D for you. Now, obviously, every single client is going to be different. Then that's would depend on what's going on. And then we would, sign a contract, onboard them specifically, get more in-depth medical information, and go from there.
Very cool. All right. So we're going to do a lightning round.
I'm ready.
You're ready?
Okay, hold on.
Okay.
Gotta stretch out.
Yeah.
A little bit. Okay.
Don't overthink it.
Okay.
Okay. Biggest mistake families make?
Not talking about what that person wants for their healthcare sooner.
One conversation every family member should have sooner.
What does a successful day look like to you, and what resources do we need to be in place to make that happen for you?
Okay.
Stay at home longer versus plan earlier?
Plan earlier so you can stay at home longer.
Oh, I like that.
That's true. The earlier you plan strategically, it saves you a lot of heartache in the long run, for sure.
Most misunderstood part of the healthcare system.
Doctors don't know what things cost. Or insurance in general.
Yeah, they don't have to worry about that. I mean, they're trying to save lives.
Of course,
they're not worrying about the insurance piece.
Of course.
Yeah. One thing people should do this month.
Ensure you have a power of attorney in place for your healthcare and finances. It could be the same person, it could be different people. And or make sure you have an advance directive in place.
What's an advance directive?
That is a
Like
document there's a couple. One of the most familiar one is a DNR, do not resuscitate, which also does not mean do not care. People always change that. But a really common one is a living will. Mm-hmm. So like I have one with my husband too, and saying, okay, if something happens to me, this is kind of what I want. But that might not need something as formal as like a DNR or DNI.
And I'm going to add, you better know where these important documents are.
Yes.
Because if it's in the safety deposit box and the only copy is there,
Nope.
and you're out of town, your family members are out of town, it's like a passport. You better have a virtual copy up in the cloud, so if you need it, you can get it.
Absolutely. And give that person who is your POA a copy of that document. You would be surprised how often you need that. So for example, we have a client of ours who is he moved from for skilled nursing here in Evanston area, and he moved to East Coast in the DC area to be closer to his sister. His sister and brother she's the healthcare power of attorney, he's the financial power of attorney, and she needed to sell his car here and needed a copy of the power of attorney. And you'd think selling a car at CarMax wouldn't need that, but of course she needed that document. So have that copy with you, for the love of God. Please put it in a good spot
Do
too.
people like you that are a concierge or an advocate, assistant, legally, are you able to keep copies of those documents?
We do. We have virtual copies of those documents for that very reason. God forbid someone should have, or lose it, or something, oh my God, it's a crisis and I didn't bring it for me in the emergency department, I need it, then we
Thank
can
you.
easily pull up an image and have it be available for them.
And the last question in the lightning round.
Wait for a crisis or get ahead of it.
Oh, what do you think I'm going to say?
Right.
Get ahead of it. Really, the price you pay in terms of just that general control is lost immediately in the emergency department.
Absolutely.
So please plan ahead.
I think I've been told for spending $1 to prevent a problem will cost at least $10 to treat a problem.
Yes, with truly everything. With healthcare, plumbing, electric, anything. Yes.
So I think if we can spend a little bit of time or money sooner, you'll really save for it later.
Absolutely. And most of it just starts with a conversation, not just anything legally too.
Yeah.
Those are free.
So thank you so much, Mary.
Yeah.
That's my pleasure. It's so much fun to be here.
So
Thank
we
you.
will attach all your contact information to our show notes. So anybody watching who wants to get a hold of you, they'll be able to.
That sounds great.
And thank you for tuning in. Tune in again next week for another episode of
Help, Nobody Told Me.